This is Susan Luchas with debugyourhealth.com. Today I'm going to talk about how I fixed my bunions by myself at home without surgery. It took quite a long time and quite a bit of work, but it is possible to do. And if you're determined to avoid surgery and become pain-free, this is the way that I found to do it. On the website I mentioned about a book called Pain-Free Back, and I think that's a great book to learn how to sit, how to stand, how to position your feet and your whole body. I'm just going to go over two really quick points from that book that I think are essential for bunions that I just want to highlight, but I do recommend everybody get that book and go through the whole sitting, standing, because you're just going to feel better if you do. So two of the things that were essential for me for my bunions from that book. Number one was that I point when I stand or walk, that my toes and my feet here are pointed at 10 degrees outwards. I tended to walk 10 or 5, probably 5 degrees inward. I tended to have this inward kind of walk. But I kind of became aware of it and started thinking about trying to walk and stand with my feet 10 degrees outward. So that was the first essential thing from the book. The second essential thing from the book was actually learning how to reposition my feet, especially when I'm standing. So the main thing that they do in the book is that they take their toes and kind of angle them a little bit inwards. I just told you to angle your foot outwards, but I actually angle them a little bit, my toes a little bit inward, and then I turn this heel, I turn this inward to kind of create this arch here, and then I place the heel down. So now I've kind of got my toes and my bunion, in fact, kind of slanted this way, but my foot is still kind of a 10-degree outward at the end. And this basically repositions the whole toes as well as the bunion to kind of be in the more natural position. If you've ever looked at babies and looked at their feet, babies' feet tend to be in this what they call a bean-shaped position. And so that's one thing that I just always became aware of, and I always try to position my feet in this way whenever I'm standing, working in the kitchen, or even sitting at the dinner table. I'll quickly anchor my toes down on the floor and rotate that ankle under and try to get this arch and this bean shape in my foot. So I do that on the right foot, and then I do that again on the left foot here. So the same kind of thing. Ankle the toes inward, rotate that heel under, and then you've got this arch here and place the heel down. So this kind of looks like an exaggerated position at this point. But that's actually what you want to do to kind of try to reshape your foot into more of this position, which is actually our birth and our primal position that we're supposed to be in. So those were the two things from the book, angling 10 degrees out and reshaping your foot into a bean. Those were the two things from the book that were really essential for bunions. Now I'm going to go into some of the exercises that I came up with and that I did to really accelerate my bunion progress. So the first one is kind of a sitting exercise here. And what I do is when I'm sitting, well, the first thing I do when I'm sitting usually is I try to get that nice bean shape in my feet. But what I do is I cross my leg like this on one foot, and I push the bunion in with my thumb and then pull out with my index finger on the big toe. So again, this is kind of pushing the bunion in and pushing out on the big toe. When we have a bunion, our natural tendency is for that toe to point in and the bunion to stick out. And what we're just trying to do is stretch that and kind of reverse that habit, because that's what's going to get you out of pain. So anytime I would be sitting at work or sitting sometimes even at the dinner table, if I was done eating, I would just kind of sit like this, push that bunion in and pull that toe out and just sit there like that for as long as I could. And then I would switch legs, do the same thing on the other bunion. I only had pain on my right side, but I recommend doing this on the left side, on both sides, because if you have one bunion, you probably have the other, and you're probably not walking right, you're probably not positioned right. and that'll lead to knee problems and all kinds of joint problems later in life. So I think it's important to do both sides even if you don't have pain on both sides. So again, I push in on the bunion with my thumb and I pull out with the index finger or with the index and the middle finger here. So I'll just sit like that and maybe be working or chatting at a meeting, at the dinner table after I'm done eating, anything like that, any opportunity that I get. If I'm at a meeting or a dinner table and I need to have my hands busy, one thing I do is I actually do the same thing, but I hitch up on the table. So what I do is I take this toe, this big toe, I hitch it on the leg of the table here. This is not an ideal table because it's got a huge leg, but I basically pull that toe out. And by pulling that toe out, it automatically kind of pushes the bunion in and stretches that out. So I'll just maybe sit like this, for a while, and then maybe I'll scoot my chair over and do the other side as well. So that's the other thing that I'll do if I want to be eating or working or something with both hands. Then I'll just hitch up the foot here on the table. The last thing that I do is actually when I'm sleeping, is that when I go to bed and I lie down, I like to do this, lie down, stretch my spine out. The ideal position for sleeping is actually with your toes, again, about 10 degrees out, like what you see me doing here. That's actually the ideal sleeping position. A lot of us tend to sleep like this, or sleep like this, but actually the ideal is slightly out. But if you have bunions and you're in a lot of pain, what I learned to do is I hook these two toes together. You can see how I've got them hooked up, and I basically pull them against each other like this. So I pull the toes, I create tension and I hook them up, but then I try to pull them apart. So I kind of hook those toes, instead of hooking them on the table leg, I hook them on each other and kind of pull out. And that again pulls the toe out, kind of naturally pushes the bunion in and reshapes the position of where that big toe is. And once we can reshape that joint and where that big toe is, that's how you get out of pain. That's how your bunion starts to reverse. And that's how you feel better. So then I would just kind of lay down, relax, and try to fall asleep like this. And sometimes I would actually fall asleep like this. And of course, at some point at night, the toes would come undone and I'd be in some other position. But at least maybe I had them hooked up for 10 or 15 minutes or something like that. Sometimes I couldn't fall asleep like this. I felt like it was too uncomfortable. So I would maybe just, while I'm relaxing in bed before I fall asleep, or whatever you do before you go to bed, if you meditate or anything like that, I just hook up for that amount of time, and then go back to your kind of 5 to 10 degree out position to sleep. So this is Susan Luchas with debugyourhealth.com, and I hope that this informational video about bunion exercises is useful to you.